Thank you. Thanks, Peter. I think I'm unmuted. I hope I'm unmuted.
You are.
You are great. I'm Bev Holmes. I'm CEO of the Michael Smith Foundation for Health Research, and I'm joining you from my home in Vancouver, which is on the traditional, ancestral, and unceded territories of the Squamish, Musqueam, and Tsleil-Waututh nations. And I'm really delighted to be chairing a panel of colleagues who are collectively charged with setting the stage for our discussions at the symposium by talking about elements of a provincial health research response. You'll hear more about the resources to support that research response in the first session tomorrow, chaired by Sterling Bryan of the BC Academic Health Science Network. So here is how the session is going to flow this morning. David Patrick, Director of Research for the BC Centre for Disease Control, is going to talk about how COVID-19 has unfolded in British Columbia and how that links to the research response that we're all discussing today. Victoria Schuckel, Executive Director, Research and Technology for the Ministry of Health, will talk about the ministry's interest in COVID-19 research and what this experience might mean for research in British Columbia in the longer term. Chonnettia Jones, Vice President, Research for the Michael Smith Foundation for Health Research, will talk about the Foundation's role in the COVID-19 research response and the importance of research talent and health research capacity to that response. Next up, we have Kelly Barnard, Project Consultant for the BC Strategic Research Advisory Committee, and she'll talk about that committee and its work in the provincial response. And Lupin Battersby, Knowledge Mobilization Officer at Simon Fraser University, is going to talk about the importance of knowledge translation to the provincial research response. Each of my colleagues will speak for up to 10 minutes and hand over to the next person. And we're going to go through all 5 at once because they're really aiming to tell an overall story. And the panel has a few questions for you as participants to think about during the presentations that might spur some discussion today. And we'll put these back up at the end of this session. So how can we, and by we mean all of us involved in this research response, how can we improve the coordination and collaboration of research to address COVID-19? Are we making the most of our BC research assets to address these challenges? What are the crucial gaps and the needs that remain? What will you take away from this panel that you will apply to your COVID-19 research and to your knowledge translation efforts? And what more can be done at a provincial level to support the use of COVID-19 related evidence? So we'll welcome your thoughts or questions on those at the end of the panel presentations, but also encourage feedback on those at any time to that email address. So SRAC, that's the Strategic Research Advisory Committee at MSFHR.org. Of course, you're welcome to ask your own questions of the panel. Please use the chat function for that. My colleague Jen Creighton from MSFHR is going to help me monitor that so I can pose questions to your colleagues. So David, over to you to kick things off.
Good morning, everyone. I too am speaking from unceded Coast Salish territory here at BCCDC, and I wanted to share with Elder Margaret that recently I was on Elknech, which is the original Squamish name for Gambier Island, and had the privilege of seeing a family of wolves on the beach at dawn. So we live in a miracle. It would also be a miracle if I could properly address the full public health response in just 10 minutes. So forgive the fact that this is going to be fairly high level in terms of a summary of what's gone on. Next slide. For those of you involved in public health of other kinds, chronic disease prevention, working with social issues, it's worth a reminder that the defining feature of a pandemic, of a communicable disease, can be exponential growth. So by now, everybody's familiar with the R-naught concept, the idea that it's the average number of secondary cases for a primary case, so that one case can give 3, and 3 can give 9, and 9 can give 27. And of course, we've had jurisdictions around the world who've been caught behind that exponential curve, who've seen its wrath, but we've been a little luckier in blunting it in the early days of this epidemic. The graphic on the right-hand side is really telling us that if we had, for example, 2/3 of people immune, we'd have that reproductive number down to 1, we'd have it slowed down. But we don't have immunity because less than 1% of people in BC have been infected, and we don't have a vaccine. So let's go to the next slide and discuss in broad strokes some of the broad public health measures that do drop that reproductive number. all this emphasis on testing and case finding, it doesn't live in isolation. It's the identification of people who are living with the virus and their isolation at hospital if they're ill or at home if they're not very ill. That makes a huge difference in breaking that chain of transmission. And further, because the contacts of people with infectious cases can themselves develop the infection, maybe even pass it on for a day or two before they recognize it, contact tracing serves to help identify those close contacts and ask them to stay out of circulation as well. As per the graphic on the bottom right-hand side of the page, notwithstanding the decision in Russia to go ahead with a vaccine without a phase 3 trial, immunization is not ready for prime time scientifically. Next slide, please. Next. What we don't speak about enough is how much we rely on the public for this, as well as the public health service. And keeping a small bubble remains important. Bonnie's asked us recently to remember that when it comes down to entertaining. Our own decisions to stay home when sick or to seek medical care under those circumstances is important. There's a science behind physical distancing, particularly in enclosed spaces, and that science tells us that 2 meters distance is better than 1 meter, and as the Europeans have clearly shown, 1 meter is way better than nothing. And then we do know that masking, when this is not possible, especially indoors, that we're seeing increasing evidence for the benefit of that as well. Next slide, please. So I don't know how many of you think, you know, if you double your bubble, what happens to your transmission risk? Well, the first thing is if nobody's sick in your network, you've got no risk. That's quite true no matter how big it is. Hit the animation button, please. Okay, if somebody's sick, the chance of someone else getting it are actually a function not of the number of people in the network, but the number of links. Hit the button. And so here's my excellent graphics here, stickmen and lines. You can see that if you've got 2 people, you've only got 1 link. If you've got 4 people, you've got 6 links. Hit the button, please. If you've got 8 people, you've got 28 links. And I couldn't draw 16 people because that's 120 links along the way. So rather important to remember that. Next button. And so for those of you who like math, this is just a reminder that that relationship is nigh on fully exponential. Okay, next slide, please. So as things unfolded in BC, as you know, we actually had early notice on New Year's Eve. There was some of the first communication going out in BC about what was going on in Wuhan. We had rapid development of testing at the public health laboratories under Dr. Cragston. We had relatively early and stringent lockdown by international comparisons and distancing measures instituted really around mid-March towards late March. That led to attenuation of the infection rate by May. And it means we've had about 200 deaths to date, but if we had lived with the American average, we would have about 2,000 by now. So it's important to bear in mind that much of that exponential growth was attenuated early in the epidemic in BC. We've also seen parallel efforts to accelerate research across the full spectrum, which is what today is all about. We've got a strategic research advisory committee trying to move that along. We've got a clinical research coordination initiative here. We've got the Academic Health Sciences Network coordinating information about research and ethics and clinical trials. And we've got the Michael Smith Foundation helping to coordinate rapid response research as well. Next slide. This is just the same thing on a graphic, so I'm not going to go over it, but bear in mind that early in the year, we weren't seeing a lot of cases. We didn't see our first case until late January, not long after we had the test available. And for a while, it looked like maybe we could avoid importation, but around the time that pandemic was declared by WHO, we were seeing an increase in cases in BC, and that's when all of these measures that I've mentioned had come into play. At this point, there's been an effort to drop those measures, and while we're seeing something of an increase in cases, refreshingly, we have yet to see that become a problem in the elderly, for example. Hit the button. Now, across research, there's an awful lot going on in BC, so I'm just going to talk you through this very quickly. On the left-hand side, it's very important that we characterize this new pathogen, that we learn how to develop drugs and vaccines to it, and we put those through to clinical trials and so forth. But on the right, when we're dealing with this as public health people, we have equivalent sciences that require us to model and learn the epidemiology of what's going on, that require us to look at how different populations experience this differently. We need to think, therefore, where we would use vaccines if we had them, what the priorities would be. We need to think about the impact of a pandemic on health services, and we need to think about the priority populations that we have to pay special attention to. And so down the middle, all of these things translate into many of the things we see in public health and public health service: surveillance, diagnosis, prevention, clinical treatment, mitigation of impacts, and working on the social environment and the population impacts. We have researchers working on all of this in BC right now. Next slide, please. It is very important to acknowledge at this point in the pandemic that our early responses can have had unintended consequences. School closures were not a wonderful thing for most children. There are risks to childhood development and to mental health and of children staying home. Overdoses in BC have outpaced COVID deaths, in part because people who might have been using in company might have been more likely to use alone, but probably largely because of a degradation of the quality of the illicit drug supply. We've had delay of procedures. We've had huge economic unemployment and general life stress disruptions. And these problems have not been equitably distributed. There are some who can just sail happily through this pandemic because of the level of comfort that they live in. And there are others, probably at the margins of employment, who have suffered the most. Next slide. So where we need to go now is toward a sustainable response. Button. This virus will be with us for a while yet. A year or two, it would be before we see a vaccine. Hit the button. Vaccine may or may not change the picture next year or the year after. Button. The massive lockdowns that we saw in the spring are untenable in the long run for any society to maintain cost-wise. The button. We need to resource the public health service to contain transmission, and you've seen the Minister and Bonnie announce ramp-ups of contact tracing services. Equally, hit the button. Public engagement and participation are the other half of that equation. We need public health services and the public to go lockstep in trying to reduce transmission so that we can open up the economy, get schools open, and so forth. Next. We need to consider new evidence and all the tools in our toolbox. The clinicians now know that they can save lives with dexamethasone in the ICU. We also have better evidence now for the impact of non-medical masks having a protective effect if used widely in crowded situations. No panacea, but that evidence did not exist 6 months ago. Next button. We need to learn from our early experience and button. Continue to organize research to provide guidance and hit the button. And that's really what today is all about, that, in an introductory fashion. I'd like to leave you with one image. I saw an image of Pooh walking through the 100-acre wood with Piglet the other day, and Piglet is asking Pooh, how will we know if our pandemic response has worked? And Pooh says, they'll tell us that we've overreacted, and welcome to public health. So I'll stop with that. And we can move on to the next speaker, I believe, because we'll take questions at the end. And so the next speaker is Victoria Schuckel from the Ministry of Health.
Hi there. Good morning. I would also like to thank the SFU organizers, not just generically, but because some of the comments that I'm going to make speak very specifically to the ministry's interest in events such as this. This is critically important. Thank you. Oh, there I am. So I only have 3 slides. My presentation is going to be relatively short, and really what I want to do is talk about 2 different things. One, I want to outline for you what we from the ministry see as our key interests in the research response. And the second is to tell you a little bit about the work that's been happening and continues to happen inside the ministry with the ministry's identified research priorities. So that's what I'm going to talk about. And I don't think I need to say anything given the comments that have been made about the overriding interest that the ministry, of course, has in physically, mentally healthy, resilient British Columbians and a healthcare system that has not collapsed under the weight of of the epidemic. So that's been well established by the opening comments. So these are you see on the screen, two points. And I'd say these are probably the biggest ones we have. The other ones are really important too, but the ability to focus research so that it is highly actionable, that's prioritized, and that this research gets into the hands of the decision makers, which is easier than it sounds, given that we know that there are 300 or 400 research studies that have been externally funded. Some of those, the 400, some of those represent research projects that have pivoted. So the volume of research is enormous, and the process by which we would actually think about getting that into decision makers' hands is daunting, because decision makers are also currently involved in addressing a whole bunch of issues and do not have an opportunity necessarily to engage in all the areas of research that are currently underway. The second priority from the ministry's perspective is really to maintain or increase the public's trust in research and evidence. I don't have to say too much about this. We can look to our to the south of our border and see some of the public discourse that's happening and some of the reactions against the use of masks and other manifestations around vaccines. That, not to say that that doesn't exist in Canada, but we see it as critically important that the provincially coordinated research response to COVID is well coordinated, and that it does not leave the public with a sense that there's no coordination and that it's coming all over the place. That said, there's lots of different researchers researching lots of different areas, and they're going to come up with different conclusions, and it's not about coming up with common messages, but it is that we have this remarkable opportunity to illuminate the role that evidence can play in decision making. That said, Bonnie's comments are well heard. It is not solely evidence, it's evidence and values and other kinds of conversations and discussion that are brought to bear in decision making. Next slide, please. So our interest, the ministry's interest, is that the research project, that this unprecedented volume of research projects are as coordinated as they can be, given that the funders are CHR, Genome BC, Michael Smith Foundation for Health Research, others are coming out at different stages and are seeking to support the best research projects that they can. And duplication isn't typically necessarily a bad thing. In fact, it's a good thing, because it allows us to understand different methods and different results and learn more. But we know that, at least from the perspective of the small amount of funding that the ministry has, the funding that Michael Smith has, and that Genome BC has as well, and I'm speaking about those two because the ministry provides funding to those two organizations. We know that for everybody's sake, it needs to be as strategic as possible, and that we don't actually want to be funding things in the province that CHR is already funding. The second is that relates to the comments that I just made, is that there are mechanisms and there are opportunities for research funders to collaborate so that we can avoid multiple funders or more than one funder funding the same thing. Again, it's not that I'm thinking that all duplication is unhelpful, but when you saw the visual that David put up showing everything from pathogen characterization to impact on subpopulations, there are so many areas. When we get to the ministry's research priorities, you'll see the ministry's identified a ton of questions, and we just don't feel like in spite of the vast amount of resources that are going into this, that we have the luxury of spending it in places where questions are already being answered. And then the last interest reflected on this slide is just that the research infrastructure is accessible to researchers throughout the province and the gaps are filled. We know that BC is a population of 5 million people and that we have many things going for us in terms of our assets. The infrastructure that I'm referring to here includes biobanking and clinical trials and ethics and expedited access to research. It also includes the regional infrastructure that has been created through the BC support unit with the AHSN and the engagement of patients and public members in research. We have a lot going for us. And so we want to make sure that the opportunities that we can leverage some of the infrastructure and the investments have been made historically and provide opportunities for for the full range of post-secondary institutes to engage and to use some of the skills that they have to answer the critical questions that are being raised. Thanks. Next slide. Yeah, and then this is sort of the higher level question, but again, the spotlight is on research, and we do have, with Bonnie Henry, with our provincial health officer, having the great joy of our PHO being featured in the New York Times and on CNN, and jurisdictions in many places looking to BC about how this has been handled. In the presentations and the regular updates that Dr. Henry has been providing, featuring analytics, featuring research in the information that she's communicating to the public, there's this extraordinary spotlight on research. So as talked about earlier, but what we really want to understand, because we've always been wanting to understand this investment in the infrastructure that's taking place in the province and all the assets we have, what is possible if we truly have a research system that can, not 100%, but that has the capacity to mobilize and respond to
Victoria, you just got muted.
Sorry, not sure what I said. How long ago was I muted? Just a minute ago?
Organize and respond to were the last words I heard.
Okay, anyhow, basically we have this opportunity to really show what the health research system can do when it's working with the health system, and to demonstrate the power of this adaptive learning health system. And I think honestly, that's the big thing, that we will have opportunities, and we already have had opportunities for the researchers who are part of this call and ones who aren't, to make really important contributions to the questions that people are grappling with. And when we look at the whole thing and we see what did we accomplish and what can we accomplish and what still needs to be filled, I think from the ministry's perspective, that's what we really want to understand. What can we achieve when we pull these two things together? Last slide. So very quickly, I just want to say that the process, that there were 40 research priorities that were identified by the Ministry of Health. And this arose from the research and technology branch that I'm in, and a number of other people, including Nicolette McGuire, who some of you know, worked with first off, Nicolette was in contact with post-secondary institutes and institutions and health authorities to basically understand what was going on, and helped with team to put together the first inventory, putting all the externally funded research into a database, which the AHSN has taken on, has done an amazing job with. But that initial conversation about what are you doing, what do you have the capacity to do, what are you thinking about doing, what have you already been funded to do, was an important part of just getting us sorted. The Ministry Research Committee is a committee that has representation from all areas of all divisions within the Ministry of Health. It meets monthly, and through that process, priorities were identified by each of the divisions. That was taken in by the branch. It was organized somewhat and taken up for approval to the senior executive team, which represents the deputy minister and the ADMs and the associates. The back and forth that has happened when I say canvassing, analyzing, consulting, validating, mapping, repeat, is that for each of those 40 priorities, and we have ranked them in terms of importance. We've also had to have a lot of conversations with different areas in the ministry where there are potential synergies and different perspectives. For each of those, a two-pager has been created which maps all of the externally funded research to that question. And we basically say, do these 5 projects that exist in this area, do they directly answer the question? Do they indirectly answer the question? We've also mapped any of the analytic work, as we know it, that's happening in the ministry to answer those questions. And we've also mapped, does this relate to any of the projects that are being undertaken under the BCCDC Provincial Health Officer listing of some of the unintended consequences. So just to make sure, so it's internal work, and we keep going back to the programs, or we have, as we're trying to figure out, okay, which ones of these have already been addressed and we don't need to do anything about them. We just want to make sure that there are connections that have been made between program areas and the researchers, and we will make sure that that happens. We also are asking them again, when we're going through the list again, we're saying, do you still need this? How are you going to use it? And we really want to understand how are you going to use it, because we don't have the luxury of anything that's not actually going to inform these questions that people are trying to answer. We've also had additional comments or conversations with some members of the executive team just to say, okay, here we are. These ones have been answered. These ones have recently been funded through CIHR. This is where we're at. Of these 5, which do you think are the priorities? And as you can understand, there are very few of these questions that are static, and that there aren't other things that are happening to address them or that influence how they are even being framed. So that's why this process is happening. We will be partnering with the Michael Smith Foundation to answer some of the questions, and you may hear about that going forward. Not you may hear, but the way that they'll be doing it will be in a rapid way. What I want to say, okay, sorry, Nicolette's saying something to people, which is good. And then just in closing, what I want to say is that we so appreciate the work that has been happening, that the amazing work that's been happening through the post-secondary institutions, and we are so grateful for the talented researchers that exist in the province. And it's time for me to wrap. So I want to say thanks very much for the opportunity to share this information from the Ministry of Health. And without further ado, I'd like to introduce Dr. Chonnettia Jones, Vice President Research at the Michael Smith Foundation for Health Research.
Thank you, Victoria. And again, I would also like to extend my thank yous to Margaret Elder and Dr. Bonnie Henry for their warm welcome, and to the organizers. It's a real delight to be able to participate. The Michael Smith Foundation for Health Research, sorry, next slide please, is British Columbia's health research funding agency, funded by the BC Ministry of Health and accountable to a cross-ministry committee. Our core mandate is fourfold: attract, develop, and retain research talent that contribute to the knowledge economy. Ensure decision makers have access to research evidence that inform policy, planning, and practice. Support research to address BC health system priorities and maximize government's investment in health research across all areas of our work. Next slide. As a provincial health research funding agency, therefore, the Michael Smith Foundation is well positioned to respond quickly to provide research evidence and to support a coordinated provincial research response to COVID-19. When the pandemic was first declared a public health emergency in March, we acted quickly and initiated rapid research projects deemed a priority by the provincial health officer. Together, these projects sought to describe the prevalence of the virus in the population while assessing the effectiveness of public health measures and public cooperation required to slow the spread of infection. It was also clear at that time that there was a need to develop vaccine candidates. I'm not going to say more about this work because the researchers leading those studies will present their work in this symposium. Next slide. With funds from the Ministry of Health supplemented by Michael Smith mandate funds, we funded 20 research projects across the province to address BC's COVID research priorities. This graph shows COVID awards mapped to research priorities which were identified in consultation with the Provincial Strategic Research Advisory Committee, from the rapid evaluation and modeling of public health measures to the impacts of rapid health service redesign on health outcomes. They include partnered projects with other provincial funders like BC Hospital Foundations and a range of research projects to study populations that may be differentially impacted by COVID, including children, Indigenous communities, frontline healthcare workers, and those in long-term care housing. The researchers, again, leading these studies will be presenting their work over the next 2 days. Next slide. Leveraging our partnerships with federal research funders, we have also co-sponsored projects to direct funding into the province that addresses BC research priorities. You will hear from these researchers themselves. We will also soon announce newly funded research co-sponsored with the Canadian Institutes of Health Research on the impact of COVID-19 on mental health and substance use services. Next slide. COVID has led to significant disruptions to research in the short term, and we expect there will be long-lasting implications into the future. To support BC's recovery and ongoing resilience, Michael Smith's priority will focus on 2 core strategic directions: retaining and supporting BC's talent base and strengthening health research capacity that BC needs for the future. It's important, however, that we consider what this means in a changing research environment. To understand the impact of COVID on BC's health researchers, we've consulted with research leaders across the province, as well as launched a province-wide survey to understand the impact of the pandemic on BC's health research community. This survey included responses from master's and doctoral students, postdoctoral trainees, early, mid, senior investigators, and clinician scientists in the biomedical, clinical, population health, and health services fields. It's no surprise that we heard about major disruptions in research due to the curtailment of research activities at universities, health authorities, and clinical research sites. We heard disruptions in training, career progression, and income for graduate students and postdoctoral fellows. We heard concerns of researchers about the challenges they're facing to attract, recruit, and retain highly qualified research talent in BC. And we heard particularly difficult challenges for students and faculty with caregiving responsibilities. So we will soon announce actions we're taking to retain and support BC's talent base. This includes providing funding stability and continuity for BC researchers whose research has been disrupted by COVID. And we are working to increase the diversity of our programs, including more funding to support talent in the North, interior, and on the island so they can study research questions of importance to those communities and train the next generation of researchers who will contribute to strengthening health research capacity in those regions. Next slide. Every individual and community across the province has the right to equitable access to new treatments. This includes access to research studies and clinical trials to discover treatments that will help to protect patients and the public against not only this public health threat, but public health threats that we will undoubtedly face in the future. Research carried alongside clinical care at BC's health authorities play an important role in this. Through discussions with the Ministry of Health and the BC health authorities, we learned of significant pressures placed on the health authorities because of the pandemic. Several of the health authorities have stretched research capacity and are finding it difficult to support new COVID studies as well as to safely resume non-COVID studies. We found there is regional disparity in the ability of health authorities to support research. Health authorities in some areas of the province are in a good position to respond quickly and deploy resources to support research. In other areas of the province, this research infrastructure is lacking. So we have made awards nearing $1.5 million to 5 BC health authorities to stabilize and sustain health research capacity in those regions. This funding will initiate the planning and co-development of a longer-term regional health research capacity building initiative in partnership, not only with the health authorities, but the BC Academic Health Science Network, the Ministry of Health, BC universities and research institutes, patient partners, and other provincial networks and partners. Next slide. Lastly, working with the Ministry of Health, we provide strategic and secretariat support to the COVID-19 Provincial Strategic Research Advisory Committee, which serves as a bridge between BC government and BC's health research community, as well as makes connections to national bodies. The committee plays an important role in facilitating a coordinated provincial research response. It looks for opportunities to make the best use of BC resources to advance BC's COVID research priorities, to reduce unnecessary duplications, and to see that the knowledge produced from COVID research evidence informs decisions on health policy and practice that will benefit patients and the public. You will hear more about the role of knowledge translation in the provincial research response to COVID later by Lupin, but I'm going to hand over to Kelly to tell you more about the Provincial Strategic Research Advisory Committee.
Thank you so much, Chonnettia. That's wonderful introduction. I'm very pleased to be able to talk to you a little bit about this very interesting initiative. As Bonnie said, we think this is unique across the country and perhaps anywhere as an effort to try and bring together some resources to support the coordination and really great response to this situation. Next slide, please. We were faced with a rather daunting task, just tiny little task of dealing with an unprecedented mobilization of research worldwide. We all know that there have been an avalanche, and this is an ongoing avalanche of studies, emerging methodologies, results, and we're situated in BC, where we have very specific needs, but also very specific strengths and opportunities. And so sorting out how we tailor our research response in this environment to best meet the needs of British Columbians, as well as contribute to global efforts. With our strengths, we do have the opportunity to learn things here that may not be easily learned in other places. We have the opportunity to view the health research environment in BC under this spotlight. As Victoria said, you know, we have a chance now to look to see how well we can mobilize, how well we can support our researchers and respond to a challenge such as this. And that means identifying and addressing some of the structural and systematic impediments that there might be, appreciating the things that work well and fostering and improving them. And we have to do all of this while continuing to support the provision of evidence in real time to help with the decision making that's required. So just a tiny challenge. So this requires some thought and some coordination and some advice. So next slide, please. The BC COVID-19 Strategic Research Advisory Committee was struck, as Chonnettia has said, to help advise the province on priorities, funding, coordination, enablement and dissemination of research projects and into the health system response. And I must stress here that this is an advisory committee. The group provides advice, where there's no direct operational responsibilities or other tasks, but rather we're serving to try and frame, advise, and oversee some of the initiatives to provide feedback and help in deciding what needs to happen. We're focusing very strongly on BC specific needs and strengths. And I think this is very important. We have strong research community. We also have a health system that is based on a regionalized, horizontally integrated system that provides us opportunities for research from bench to bedside to community in a way that many communities do not have the opportunity to look at it in that way. And as Chonnettia said, supporting the health authorities in their participation in understanding the full range of impacts and opportunities from this horrible situation is something we can do here in BC in a way that many jurisdictions cannot. We're also tasked with assuring that the researchers, funders, universities, and government are reciprocally aware of priorities. So that means not just responding to requests about priorities from government, but also offering from the scientific community suggestions about priority areas of research that might indeed help with the response. And also to provide specific advice on request from governments, funders, and others to help sort out some of what those priorities might look like and some considerations for thinking about funding, its distribution, and any gaps or overlaps that might occur. The group reports to the Ministry of Health, originally to the Health Emergency Coordinating Group, and now directly into the Ministry of Health through the ADM David Byers. Next slide, please. We have a cast of characters who meet on a weekly basis. This is the group. I won't go through all of them, but we're a broad group of researchers and health providers who are assembled to provide this advice. We're in the middle of some changes, and I'll talk to you a little bit about those further. I'll leave you with this slide, and it will be available for you to peruse at your leisure to read about the full committee. Next slide, please. We also are well aware and very grateful for the fact that we're in a research environment in BC that has mobilized to coordinate. So we are in an environment where other groups have come together, recognized the need to foster cooperation, collaboration, organization. UBC has an amazing group, which is the COVID-19 Clinical Research Coordination Initiative. And this has reached out to province-wide focus and is aimed at translational research. We also know Genome BC has stepped up with a whole bunch of rapid response projects and is working to organize those things more on the basic science side. We'll hear more tomorrow about BCAHSN and the inventory. Within weeks of the need, they stepped up to support the documentation of research funded in BC and assemble this in a central place as a resource. This was incredibly and continues to be an incredibly useful resource for us to help understand the whole breadth and extent of health research that's going on in BC. As well, the Clinical Trials Network has been established to try and coordinate that work and is doing a great job at that. We've also been supported by and understanding some of the coordinated response that's going on in the work on unintended consequences and other areas. Next slide, please. So one of the examples that came up early, so our group meets and reviews some of the research that's going on, and early on we identified the need to understand a little better the longitudinal convalescent cohort of COVID patients. This group of people, as they evolve over time and over the epidemic, are situated in the middle of this situation in that they have experienced the care required, if any, and they also are representing our window into the knowledge about how this disease occurs, progresses, and affects people moving forward. So we realized that where they sit and their understanding of them is a window into prevention and other activities that need to occur. Next slide, please. As such, we also identified that everybody is interested in them. People literally want a piece of these people. They are going to be bombarded with requests for their time, their body fluids, their psychological profiles, and so on. So we know that this group are going to be under intense scrutiny. And this is from all areas of research, and including clinical research, where there will be people who are both requiring them to participate in research, but also providing them care. And so it's really important to understand how all of these might affect a person who is in this situation and a group of people as they evolve over time. So we also understood, and it's critically important to remember, that some of this work is very time sensitive. Understanding the immunological response requires getting an understanding from the time of infection to the convalescent period, and understanding how the immune response evolves over time. So sorting out how we coordinate this is an important thing from the patient perspective, but also from putting together all of these areas of research. Next slide. So from the patient's perspective, they're being bombarded with requests for the use of their data, to be examined, to have their body fluids used, to participate in a myriad of clinical trials, and to participate in surveys. And at the same time, the health system is tasked with providing them evidence-based, good coordinated clinical care in a situation where the actual disease trajectory and the natural history of the disease are not immediately obvious. So it's a real challenge, and I have to say that UBC and others have stepped up to the plate and are beginning to work together to coordinate the efforts in all of these areas to best meet the needs of not only these patients, but also the population as a whole. And so this has been an extraordinary effort and continues. We have the opportunity here to look at the entire cohort. We know that in BC, with the way we test as a publicly funded province, we can test and identify all of the patients that are tested and positive and follow them in a way that many jurisdictions do not have the luxury of doing. Particularly, our linked population data affords an opportunity to look at issues such as pre-existing health conditions and other matters that might be more easily studied through that kind of an approach. Next slide. So we really realized early on this is an urgent situation, and we have to understand the evolution not only of the disease over time in the population, but also of the research needs and learning that occurs as we progress. We have to focus early, as David has said, on understanding the initial disease characterization and epidemiology, and it begins as rather descriptive work. And as we move through time and understand a little bit more of impacts and have some more data and understanding, we move into analysis and action, and hopefully as we move forward into insight. So the group has characterized a lot of the framing of our research priorities and understanding in this time frame to help group and understand how we might set priorities and how those might evolve over time. Next slide, please. Our initial work was represented in a document that has been posted, and I hope people have had a chance to see. This is the Strategic Research Framework, and it was always intended to be an evolving guide to help stimulate questions, identify priorities, and identify some tasks, both in the actual provision of research, but also in the supporting structures that are necessary to enable the research to occur quickly, efficiently, and in a sensitive and ethical manner. So we have had a lot of feedback and a lot of input into issue 2, and I'm very encouraged to see that and encourage it from all of you. To date, we see that needs that have been identified are more knowledge synthesis and translation, including some of issues that we might not have thought about, including the impact of non-peer-reviewed publications and how to interpret those in the synthesis of evidence to guide action, and also the impact of non-COVID care on and resources. The unintended consequences work that the ministry is undertaking is also a key component. And as I said, with the longitudinal cohort, the need to characterize the disease and its sequelae. Next slide, please. So our next steps are to evaluate how we've done, the role and structure of the committee, including broadening the perspectives, as that has been a big part of the feedback that we've received to date. We've already have representative from the representation, Jeff from the Network Environment for Indigenous Health Research, and Alice as our bioethics person. We're also through events like today, participating in the encouragement of the dissemination and collaboration, and sponsored symposia both with researchers and others to try and increase opportunities for this collaboration. And as well, the very important work, as Chonnettia has said, about working with the national funding bodies and organizations that have sprung up to respond to this crisis, including the Canadian Task Force on Immunity. And we look forward to continuing that work. Next slide, please. So I'm now handing it over to Lupin Battersby, who will be talking to us about the very important topic of the knowledge translation in this setting. Thanks.
Thanks, Kelly. Good morning, everybody. So yeah, we're going to talk a little bit about knowledge translation, although it has been talked about, I would say, throughout the morning, starting with Bonnie. So thank you, everyone, for leading up to this. But before we dive into the content, I want you to take a moment and look at this beautiful cow and think about how this cow, I'm trying to inspire some creativity, I'll give you a little context there. I want you to think about how this cow could help you do knowledge translation of your research and your work. I'm going to give you 30 seconds. I want you to come up with as many wild and silly ideas as you can. There's no wrong answer. Try to get 6 ideas if you can. I'm giving you 30 seconds, and feel free to add your wildest or even your moderately wild ideas in the chat. Okay, as much as I'd rather, almost wanted to sit here and read everybody's comments for the rest of my presentation, I will get back on track, but you can feel free to add your ideas. You can use the cow in your KT presentation slide. Yes, that's a great idea. Anne-Marie Nicole, calming tone, exerts authority. But might need to have a haircut in order to maybe be more authoritative. So great. Thank you for embarking on that little journey with me. Feel free to keep thinking of ideas as we go along. And in case you have no idea what we've all been talking about knowledge translation, or knowledge mobilization is another word for it, or knowledge exchange, there's lots of terms for it. But really it's all about doing more with what we know. It's about this concept that we've been talking about all morning of bringing our research and our practice or policy together, informing each other. And it might include doing or studying even things like implementation, dissemination, co-creation, commercialization, all of those kind of fit under this umbrella. So why are we talking about this in this context? I think it's already been pretty well established this morning, but I'm going to summarize it from my perspective as sort of 2 main areas why this is important. One is around public awareness. As a few people have mentioned, we have had rapidly developing and changing evidence, and it all seems to be happening in the public sphere. And part of that is because the public wants to know. They want to hear. We want to hear. We want to do the right thing. And we're curious to know what the science is saying. But there's also a degree of suspicion from the public. There's also what some people call the infodemic, which is like the deluge of information, but also the deluge of misinformation or disinformation. And so all of us here today have a certain responsibility to respond to that infodemic in our own way, from our own expertise. And I've just highlighted here a wonderful Canadian, Timothy Caulfield. If you don't already follow him on Twitter, I recommend it, talking about a recent study that's suggesting that Americans, the majority of Americans might decline COVID-19 vaccination. And part of that is around this trust issue and around this disinformation. And of course, that's in America, so we might be in a different place here, but we might not be. So we still need to be taking our responsibility and responding to and letting folks know what the real story is or what we know from our experience and our research. Excuse me. The second area of why this is important, and again, I think it's been made clear throughout the morning panel, is we want to have research impact. This is why we've all decided to pivot our research to look at COVID-19, whether it is at the bedside or at the lab or looking at those unintended consequences. We're doing this because we want to have an impact on what is happening to help make change, to improve this situation, to change the situation. And so again, it's our responsibility as researchers or collaborators in research to facilitate that research impact. And I've put up here on the slide the welcome trust statement around research data and findings, the importance of sharing that. This is an international organization from the UK, and there are a huge number of folks that have signed on to this statement, really showing us the importance not only in BC, and we know that everybody here in the panel today is supporting this knowledge translation goal, but also it's across the world. So some of the work has already been mentioned of how BC is supporting coordinated efforts around knowledge translation. We have the activities that are building or strengthening connections, because again, in order to be building those bridges, we need to have connections. Kelly and others talked about the Strategic Research Advisory Committee, but there's other initiatives happening as well. And then there's also various mechanisms that have been facilitating coordination of research, but they also are disseminating that research too. So if you already know your research is on one of these platforms because you did sign up and let folks know what you're working on, you need to make sure that you're updating those. And these are resources for doing that. So as I've been saying is, can you have an impact with your one study or with your one collaboration of research? Yes, you can have an impact. Set some goals. Obviously, it's best to be realistic. And then be strategic. Don't try to do everything. If you're not already on Twitter, maybe you don't need to start a Twitter feed right now with your research, but explore what will make sense for your particular study, in your particular discipline with the resources that you have. And you don't need to do every single thing that you've ever heard of that has considered a knowledge translation activity or a dissemination strategy, but you can be strategic about it and pick one or two. And while you're doing that, or even before you make that strategic decision, identify what your impact pathway is going to be. Do you want to influence policy with your work? Do you want to change the public behavior perhaps? Or do you want to make a really great contribution to the current evidence to lead to better and more and new research? Then you need to be looking at these opportunities, pathways, the impact pathways that would relate to those goals. So for policy, it might be you need to be collaborating. For changing behavior, you might be needing to be engaging, say, with patient partners on your research team. For academic contributions, maybe think about interdisciplinary working. And so that's where you need to start on your impact pathway journey, is with the question of who do you need to be working with to achieve your impact? Is it with a patient partner on your research team? Is it with a decision maker? Is it with a healthcare provider or a family caregiver or other researchers from other disciplines that you haven't worked with before? And And then you need to determine how you're going to work together. It's a very important part. Think about what the degree of engagements is going to be, and what both of you are going to gain from that collaboration, and that it can be richer and you can really dive deeper. And finally, and we've talked a lot about it, I would say this morning, is you want to leverage the resources in the community for knowledge translation. You don't need to do everything by yourself. And also you could consider using a knowledge translation model, theory, or framework. I'm a big fan. And I have put one here just as an example. It's the co-produced Pathway to Impact from David Phipps out of York. And it just captures that collaboration and the journey being together on all of these different levels of that pathway to impact. You're not needing to go on it alone. And so to come back to the resources, because I think it's important to emphasize this, and I think it's a nice wrap up to this conversation and brings what all of the panel guests have been talking about today, is there is resources for planning. You could be, if you're at SFU, which I'm sure a number of you are, you could be coming and talking to me at the SFU Knowledge Mobilization Hub, or maybe you're at UBC, there's the Knowledge Exchange Unit. The health authorities, well, I know that they have been under a great deal of extra work during this time. The research departments are amazing and they have wonderful resources. Or maybe you're ready to start collaborating and you need to find some folks to collaborate with. You haven't done this before, you don't have established relationships. Connect with your regional, your BC support unit regional center. They are there to support those collaborations to develop. Maybe to recruit a patient partner, or maybe to find a healthcare provider that you want to work with in your health authority. Alternatively, you might already have finished your project, or you're really close, or you have a new development that you absolutely feel like you're ready to share. Then start looking at dissemination resources. One thing that's come out relatively recently was the BCCDC's language guide. It's a wonderful resource to challenge you to think about how you're framing your research findings so that your different communities can connect effectively, and also that you are not inadvertently creating unintended consequences of exclusion and so on. And then, of course, and we're reiterating this, is the platforms like the Inventory of Research from AHSN. If you can update your research there, give a quick little summary. And any of these other platforms are available to you as well, depending on what your work is doing. And I would also like to emphasize the importance of whatever dissemination you're doing is to make sure you go back and you talk to your participants. You feed them back close the loop, we like to say, of what the findings are to your participants, to your stakeholders, to your collaborators. Make sure those communication channels keep updated and keep open. So I'm going to end it there. I have no idea how much time I have, but if we have a moment, you could think, now that we've talked about all of this, what other ideas you could use that cow for as it relates to some of the stuff that we've been talking about for knowledge translation.
Thanks, Lupin. And thanks, everybody. Lupin, maybe we can put that picture of the slide with the questions. I just have to say that thank you to the participants, great presentations, but can I really say how impressed I am with the ideas people came up with on the cow? Because when I saw that slide yesterday, I actually am embarrassed to admit I couldn't think of anything, but Lupin, I do think you should have asked participants how the cow can help us move evidence into practice.
Oh,
you could have taken that opportunity, honestly.
Next time.
Okay. So some things for all of you to think about and maybe comment on, not just now, but again, SRAC at msfhr.org, because as participants said, we do want to be hearing from people ongoing. So we'd love to have a few questions from people. We do have a little bit of time. I actually want to start asking Lupin, I want you to just to build on your last presentation, because your comments about KT are fantastic. But I'm thinking there's got to be a balance between every single research team promoting and trying to get attention for its results, which is something that I get to say funders are often guilty of demanding too much from researchers. But a balance between that and then having more thoughtful KT and the mechanisms to actually support it. So can you just say a little bit more about that balance?
Yes, absolutely. And I guess that's sort of what I was trying to allude to in the being strategic. So it might make sense for a researcher to share their research back to their funder, for example, like particularly if it's, say, Michael Smith. For Michael Smith, and even to work with Michael Smith around the concepts of where should I be sharing this? Who needs to know? I don't think every research project ever needs to be sung from the hilltops, but there does for everybody to hear. I mean, there's always those steps of if this is the first thing ever and we only know. It's sort of like, what's the power of the evidence? How much do we know from this? How many other studies have confirmed this, and so on. So we want to be careful not to like overtoot our horns too loudly and too aggressively, and therefore overpower and contribute to that infodemic. But on the other side, it is a balance. I don't know how you exactly achieve it, Bev. If I did, I think I'd be like basically a magician. But to find a way to plan and to be strategic with your community of what exactly do I need to do and how loudly do I need to share this? Who do I need to share it with? There's a number of questions one can go through to create a strategic plan that makes sense for their own study with those specific findings, and with the keeping in mind who the audience is that really needs to hear it.
Great, thank you. Thanks so much. And there are actually, and noting in the chat that people are actually putting other KT strategies, but also more comments about the cow, and also some additional resources that didn't get mentioned. And I should say too that I understand that we actually have access to the chat after the fact, so we will be able to follow up on some of these pieces with you. I am noting the time. We're pretty good. I think we've got about 10 more minutes. What I would love to put a question to each of the participants, but just for a 1 minute answer. We're all here. We're all involved in this research response, and I think it would be really helpful to say, from each of your perspectives, how can Symposium participants both benefit from the provincial research response and some of the resources that are in place, but also contribute to it? So again, that benefiting from, but also the responsibility to make sure that BC is doing its best. And I'll just go in the order that we went for the presentation. So start off with you, Dave.
Thanks, Bev. I think this is a really interesting question, because what we are trying to do is marshal sort of our whole research potential in society towards a common effort, and we don't do that all the time. And I have a foot in both camps. I'm a professor at the School of Population and Public Health at UBC, and I work within BCCDC as part of the public health response. And it's interesting how we, to follow on from this discussion of KT, how we marry these cultures. Because if we're talking about a government public health response, we want to look at the evidence, interpret it as best we can, add in the values that people expect, and come up with sort of, we're rowing together, moving along. And yet, it is the task of academics working with the fifth estate to question things and to keep the debate going, to make sure that the evidence is true. So I'm interested in what other people think about how that's best optimized. I see some friction from time to time on that, but for the most part, I see it working. Maybe that's just what's supposed to happen.
Thanks. Great, thanks, Dave.
Ben, I would also say that, if we take a look at the early part of the response, and you're interested in how we can best coordinate if we ever have a pandemic like this again, I would go to preparedness with the funders. It was pretty clear that there was a plan with Michael Smith Foundation for Health Research for rapid response research in response to a pandemic that had been worked out in advance. And I think had that been the case with funders across the country and elsewhere, we might have had closer coordination of RFPs with the research priorities that were emerging.
Yeah, I think that's a really great point, Dave. I think it was really wonderful to see Genome BC. There was a lovely spectrum, really. So Genome BC launched some important immediate funding. We were able to work with SRAC to set some priorities. CIHR launched a lot of work, and we are starting to work with them now to get more organized. And I think we will do that even more as we go forward. So Victoria, just again, what can people do how can they benefit from, but also how can they contribute to be part of this provincial effort? Just a minute on that, please.
Sure, and what we would like to do, what we are doing, as I said, is for the ministry priorities, and for the work that's happening on the unintended consequences that's underway, that we are mapping the externally funded research that is included in the inventory that we know about. Everything we know about, we're mapping it against those topics, and we're making some internal assessments about the relevance of that research, and we are facilitating direct connections from the ministry people to the researchers. And I'll just say very briefly that I know that the hesitancy on the part of some people in the ministry has been, well, we are flat out, and so we're just trying to understand, and we can't get, are the researchers going to tell us like what they've already, will they give us like a lay description of and share information like mid-study? Will they share that? And can they do it? Can they help us understand it in a way that doesn't take us down 15 different paths? And so part of what the research and technology branch is trying to do is to support that interface between some of the programs where it's required, where it isn't, fine.
Victoria, just before we move on, is that mapping of the inventory and priorities publicly available? Someone has asked on the chat.
It's not, but maybe in the chat we can continue that conversation. And Nicolette, do you want to weigh in on that? Because we're certainly not meaning for it to be too close to the chest.
Yeah. Okay, great. Thanks. Continue in the chat. Thanks very much. And again, we'll be able to follow up on these chats afterwards. Chonnettia, quick thoughts on how people can both benefit and contribute to this provincial response.
Yeah, thanks, Bev. I think that's an excellent question. And it's actually, I don't think there's a single answer to that. So I mentioned earlier in my talk that at the Michael Smith, we've been talking to loads of people over the last couple of months and hearing from people through the survey. Unfortunately, I only presented the negative kind of picture of that, all of the challenges. But one really positive message that came through that was how much people are collaborating and working together and new ways of working. And so, directly to your question, I would say that that's the huge opportunity here. That's why we've all come together, is really, really innovating in the way that we work together and how we communicate and how we share results. COVID-19 has shown what's possible. It wasn't that it wasn't technically possible, that we weren't really organized around a shared challenge and mission in a way that COVID-19 has done for the research community. So I think there's a huge opportunity for us to do more of this.
Great. Kelly.
Yes, I just following on from what Chonnettia has said, I think this is an opportunity too to think about what are the impediments to collaboration and cooperation and quick mobilization. So the research world is based on competition, individual competition, competition for funds, competition for advancement. Each participant is involved in that world, and that's is a given. Does it need to be? And does this push us to think in different ways about how research can evolve and be developed? And how can we as a research community begin to think about the inherent structural issues that might impede some of this collaboration, sharing, openness around both what we're learning, our thoughts, our ideas, and our methodologies, and in an environment that doesn't necessarily reward that kind of work very well. So that's one of the things I'd like to throw to the research community. I'd be very interested in further discussion about how that evolves over time. as Chonnettia said, this has mobilized us all around a common issue and has shown us some of the things that might be getting in our way in terms of best leveraging research to support the people. So that's my challenge.
That's great. Thanks, Kelly. And Lupin, any final thoughts on that question? People contributing to and benefiting from a provincial response.
How can they do that? Well, I think in some ways that was sort of my whole presentation. How you can be contributing to the response as a researcher or someone involved in research. So it's listening to, attending to events like this, and getting engaged with the work that the province is doing. And I think there's just so many opportunities for researchers to do that. But I do take Kelly's point that it is a challenge for academics to think about collaborating and doing that maybe extra step of communication and dissemination, et cetera, when it's not necessarily traditionally rewarded. However, again, talk to your knowledge mobilization folks in your world, because there's lots of different ways it can be rewarded creatively.
Thanks, Lupin. Thanks, Lupin. And I think it's a really important point about what people are not only not rewarded for, but perhaps penalized for. And some of those things in traditional granting opportunities and even in academia include spending time with people, which is clearly so very important. So I'm going to wrap it up there. I'm going to say that there's fantastic comments in the chat, and we're going to pay attention to those. It's not the last that my colleagues on this panel, want to hear from you. So if you see these questions here, we'd like to get your feedback and your thoughts and ideas to srac@msfhr.org. And thank you to the panelists and to the participants. And I'll hand it over to the next session.